Hey there, Dr. JP Guidry here. Hope everybody's doing well today. Today we're going to talk a little bit about low back pain, kind of an introduction to low back pain. For the purpose of today's talk, we're going to be referring mostly to acute onset low back pain or flare ups, things like that. We'll get a little bit into persistent low back pain, but we'll discuss that a little deeper in some further videos. So low back pain is very common. Inevitably, all of us will experience at least one serious bout of it in our lifetime. How we manage that low back pain, especially the acute flare-ups, acute onset, can determine how big an effect it can have on our lives, as well as um, minimizing the chance of it becoming a long-term or persistent thing. But even those with persistent or long-term low back pain can have their pain reduced and better manage it, allowing them to those who suffer with it to still live normal lives, to return to meaningful activities and work. I will add a disclaimer that today's talk is not medical advice. It is educational material only. If you feel like you have suffered any significant injury or have serious symptoms or medical issues, please see your doctor immediately. Let's start by talking a little bit about pain itself. Pain is a very individualized experience. According to Lorimer Moseley, who's a very well-known pain researcher, there are basically 4 key points we want to keep in mind when it comes to pain, and especially low back pain. Pain does not provide an accurate measure of the state of the tissue. So what this means is the level of pain is not always equal to the level of tissue damage, degeneration, that type of thing. You can have a lot of damage, a lot of degenerative changes and very little pain, and vice versa. You can have a high level of pain with no real tissue damage. Pain is an output of the brain and it's modulated by many factors. Things like tissue damage, stress, fear, anxiety, memory, relationships, sleep, and overall health can have effect on the pain we feel. This is again goes back to the importance of maintaining our overall health and wellness and managing episodes of low back pain as well as minimizing the chance of them happening. The relationship between pain and the state of the tissues becomes less predictable as it persists. So this means that the longer that the pain lasts, the less likely it is going to be due solely or primarily to tissue damage. Pain is an alarm system for our body. So it's there for a purpose. It's a meaningful thing. We wouldn't survive long without it. It's there to tell us that something might be wrong or has already happened that is harmful to our body. It's a call to action. It's there to tell us to stop doing something, to do something different, to move, to change, to do something that we're currently doing in that state that is causing the pain. Before we move forward, I want to talk about some what we call red flag symptoms. So if you experience any of these symptoms uh, along with your low back pain, then you definitely want to see a medical professional immediately before starting any type of a exercise program. These things are loss of bowel and bladder control, severe weakness, numbness, or tingling in the lower extremities, unexpected weight loss, nausea or vomiting, painful urination, fever, pain that does not change with rest or changing positions, and any other unexpected signs or symptoms. All right, what do we do if we experience an acute episode of flare up? Number one, don't freak out. Low back pain is rarely associated with serious pathology or structural damage. Low back pain and pain in general is influenced by a number of factors, as we discussed above. Um, and secondly, don't necessarily rush off to get a scan right away. Unless you are pretty sure that you've had a serious traumatic injury, a car accident or something like that, a fall from a high height, or you experience some of those red flag symptoms above, then a lot of times scans, x-rays, MRIs can be very misleading. So things that will show up on an x-ray, MRI, things like disc bulges, herniations, annular tears, stenosis, arthritic changes can all be normal in a perfectly healthy population and a pain-free population. So just because you have pain and even may have those on your imaging doesn't mean those things are even related to your pain. Number two, move early and move often. So The old adage of bed rest with low back pain, we've come to learn has caused more harm than good. So gentle movement early on in the process that doesn't increase your symptoms is key. Also, while there's no ideal posture, there's no perfect posture out there, varying your postures throughout the day and avoiding aggravating postures early on can help. True full rest, avoidance of activity, and taking time off, a lot of time off, are generally not helpful in the long run. With this being said, you still may want to cut back on activities that can increase your symptoms, that aggravate you, that cause flare ups early on. But still, you want to stay active around that in the activities and movements that you can tolerate. The goal is to return to these normal activities as soon and as safely as possible. Number 3, maintain good health. So, for better outcomes, both in your acute episode and long term, maintaining your overall health is key. So, regular physical activity, maintaining a positive mindset, good sleep patterns, healthy stress management can all lead to a lot of obviously positive health outcomes. But when it comes to low back pain, both in the healing and recovery process as well as minimizing it, those things are key. Participating in a consistent strength and conditioning program will not only prepare your body and your back to tolerate more loads and stresses that life puts on it, but it will be beneficial to your overall health and well-being. Lastly, if you've gone through all this, you've gone some time, things are not getting better, don't waste a lot of time to seek help. Find a qualified medical professional to help guide you through the healing and recovery process and maximize and expedite that process as best as possible. So when we look at the recovery process from acute low back pain, I like to simplify it into 2 phases. Phase 1 is the calming down phase. Phase 2 is the building back up phase. So in phase 1, this is where we focus on reducing the low back pain. We're going to do this via gentle movement, temporary restriction of aggravating factors, and also using things like medications, ice, heat, TENS units to acutely reduce the pain, symptoms, guarding, spasms, that type of thing. The goal of this phase is simply just to calm down your symptoms. This is a good time to, back off those aggravating activities and positions, but still stay active. And understanding that limitations we want to keep temporary as possible. Find a few movements you like that feel good, that make you feel good, and stick to those in this phase. As we start to feel better, things start to calm down, settle down, we get into the build back up phase. This is where we focus on loading the back in a safe manner and returning to all activities. This phase will be focused on building your mobility and returning to pain-free function. We're going to be utilizing exercises that work the entire body, as well as those that focus on loading the back itself. Even with this phase, we still don't want to force anything that may aggravate your symptoms or cause flare-ups. But also understand that this isn't going to be a steady line moving forward and forward. You may bounce back and forth between the phases early on. So if you get a flare up, it's okay to back down to phase 1 and then return back to phase 2 once things have settled down. Understand that the time frames of these phases will differ from person to person. It could be anywhere from 2 to 6 weeks up to 10 to 12 weeks, depending on the person, their situation, the injury, the level of pain, the other aspects we talked about above that can affect your pain in both positive and negative ways. So as you go through this, listen to your body, let the pain guide you. The goal is progress to phase 2 and then back to normal activity as soon but as safely as possible. Within these phases, again, don't do any exercises that increase or exacerbate your symptoms. Understand that the sets and reps given are just a guide, and you can adjust based on how you feel. You want to move slowly and purposely through each movement as you feel better, pushing to the edge of pain, tension, or discomfort, but backing off, knowing when to back off. So in conclusion, if you experience an acute bout of low back pain, understand that this is normal and very common for most people. Non-traumatic low back pain is very rarely related to tissue damage and just is generally more for protective response of the body to, overloading on those tissues. In the beginning stages, focus on staying active while avoiding any aggravating activities, movements, or positions, and focus on things that relieve the pain and make you feel good. Once it calms down, then we want to slowly get away from those things, get back to normal activities, get back to a normal exercise program, and restore strength, mobility, function, and overall health. While it's impossible to 100% eliminate the risk of injury, maintaining those things, maintaining, good physical strength, sticking to a consistent strength and conditioning program, maintaining our mental well being, our sleep, our diet can all help minimize the risk of pain and injury in the long term. Again, this is Dr. JP Guidry. If you have any questions, feel free to reach out to me at John Paul, JOHNPAUL, at GuidryPT.com.